The Centers for Disease Control is urging women to get screened for cervical cancer. One of the latest reports shows that about 8 million women were not screened for cervical cancer in the past 5 years. More than half of new cervical cancer cases are with women who have never or rarely been screened. And women without health insurance or a regular doctor were less likely to be screened. Cervical cancer used to be the leading cause of cancer death for women in the United States. But in the past 40 years, the number of deaths has decreased significantly. In 2011, just over 12,000 women in the United States were diagnosed with cervical cancer, while there were almost 4,100 women in the U.S. who died from cervical cancer. Are you between the ages of 35 to 44, or do you know someone who is? Did you know this is the time when most women are most commonly diagnosed with cervical cancer? And while the disease is highly curable, 6 out of 10 diagnoses are found in women who haven't been screened in 5 years. Here to tell us more about this disease, the screening and treatment, is Dr. Cheryl Sines, a gynecological oncologist at USSD. Thank you for joining us this afternoon. First of all, what is cervical cancer?
Cervical cancer is a type of cancer that affects the mouth of the uterus. We know that the majority of women that have cervical cancer have been infected with a virus called HPV. But not all women that get HPV actually go on to have cervical cancer. So that's why I've teamed up with Genentech during January, which is Cervical Cancer Awareness Month, to encourage women to get regular screenings to help us pick the disease up early in its stages.
Are there symptoms that we want to look for in cervical cancer?
You know, unfortunately, in the early stages of disease, there really aren't very many symptoms, which is why screening is so important. Because with screening, we can pick up the abnormal cells on the cervix, and we have a better chance of curing the disease. In the advanced stages of disease, however, some women might experience abnormal vaginal bleeding, or a change in their discharge, or even pain with intercourse. Certainly, if a woman has any of these symptoms, she should see her gynecologist right away.
So, seeing as though it is highly curable, how often should we get screened?
Well, the current recommendations are that a woman starts having regular examinations with pap smears between the ages of 21 to 25. Those exams can also include testing for the human papillomavirus. And then the screening should continue on intervals of anywhere from every 1 to 3 years, depending on what the woman and her doctor decide.
So if you're diagnosed with cervical cancer, what then?
Well, cervical cancer, again, can have very many stages, and so the treatment options really depend upon the stage of diagnosis. One of the first things that a woman should do is get referred to a gynecologic oncologist. These are specialists that treat cervical cancer for a living. And with that information, a gynecologic oncologist can present a woman with all of her treatment options. Even in the most advanced stages of disease, we now know that there are several different treatment options. Recently, the FDA approved the use of Avastin along with chemotherapy for women with advanced disease, and we've even seen an extension in survival with this combination. But not all treatments are appropriate for all patients because of different side effects. So a woman should have a very frank conversation with her doctor as to whether or not that's an appropriate treatment.
Can this condition impact your chance of having children?
It absolutely can, because what we're talking about is one of the reproductive organs. And so depending upon what treatment is appropriate, a woman could lose her fertility.
Oh, all right. Thank you so much, Dr. Sines, for joining us. Good information. And if you would like more information on cervical cancer, go to our website, WBOC.com, and click on our picture at the top of the page. And Gardasil is the vaccine meant to prevent human papillomavirus, or HPV. Gardasil comes highly recommended for young girls and boys. Although many do not report any serious side effects, one teenager claims the vaccine ruined her life. Hannah Robinson's view of the television is different than most teenagers. She calls herself an aspiring broadcaster. A dream that began to fade 2 years ago when she became too tired to focus on anything. Intense body pains and even a seizure nearly kept her from graduating.
And the pain started getting worse, and I got where I couldn't even get out of bed in the morning. And then I remember one morning I just woke up and I couldn't walk.
Robinson says her health started to deteriorate after she received doses of Gardasil, the vaccine used to prevent certain types of HPV. HPV is the sexually transmitted disease that is the main cause of cervical cancer.
I just took every word they said for fact, because you're always taught to trust your doctors.
She says those doctors turned their backs on her, claiming her disability was all in her head.
They said, just think yourself better, and I thought, I've tried that, and if it would have worked, it would have worked a long time ago.
Her mother, Teresa Robinson, researched and found severe reactions to the vaccine can happen.
We're fighting this day to day.
She filed a report with the CDC and FDA's Vaccine Adverse Event Reaction System. The database shows more than 27,000 people made unconfirmed reports of adverse reactions to Gardasil. Out of the approximately 67 million doses given in the U.S. in its 8 years on the market.
You're giving them a shot, and you're taking a chance. It's like you've played Russian roulette with their life.
The Robinsons are still waiting to hear from the government about their case and have turned to alternative medicines to help Hannah. With nowhere else to go, they say they are trying to help save others.
I really had the perfect life. I really did. I had everything going for me. It's just not worth it. It's not worth the risk.
Now, federal law protects vaccine companies from lawsuits. While they can't comment on specific cases, Merck, the manufacturer of Gardasil, says nothing is more important to Merck than the safety of our medicines and vaccines. Merck employees and our families use our vaccines too. Well, vaccines are used for a form of protection, but there's not always a way to help protect our furry babies. However, there is a way you can help those who are looking for homes. Up next, we'll introduce you to some cuties looking for a place to lay their heads. Maybe you're not ready to take on a pet right now. Well, we've got just the thing. After the break, we take you to a cat cafe, how you can enjoy a hot cup of joe and some snuggles all at the same time. But first, we talk a lot about women's health. Guys, now it's your turn. Dr. Oz has more on why you shouldn't ignore the doctor.
Hi, I'm Dr. Oz. 3 times more men avoid going to the doctor than women, even if they have a persisting problem. Avoiding the doctor means avoiding preventive care measures that will help you live well longer. So my advice, find a doctor you really trust. 90% of men who regularly see the doctor go to someone that they rate as good or excellent.